so many things going on as far as this drug plague is concerned that you will never hear out in mainstream news. Now, we already know the plague is going on, but also hepatitis C is exploding around the country, and a lot of it has to do with needle sharing that's going on among these junkies out here. So, you know, hepatitis C is transferred from blood to blood. So anytime they share a needle, that's when you will see an increase in this particular disease, which completely destroys the liver. Vital signs. Opioid plague brings an increase in hepatitis C diagnoses. Addiction and overdoses are not the only consequences of the opioid plague. Physicians are also seeing a significant rise in the number of hepatitis C cases as a result of the increase in injection drug use. In fact, in just over 5 years, the number of new hepatitis C infections has nearly tripled in the US, particularly among those ages 20 to 29, according to the Centers for Disease Control and Prevention. What is Hep C? Hepatitis C is a blood-borne virus that affects the liver, causing inflammation and cirrhosis, which can lead to permanent liver damage. The virus is spread solely through blood-to-blood contact. So people who inject drugs and share needles are at an especially high risk, but they're not the only ones. Others who may be susceptible to contracting the virus also include children born to infected mothers, those who have had blood-to-blood contact with an infected person without protection, such as caregivers or sexual partners, people born between 1946 and 1964 who received a blood transfusion before blood screening protocols were implemented, those who are HIV positive, and the case for Hep C screening. The progression of hepatitis C varies from person to person. In a minority of cases, the virus goes away on its own, but more often, the virus becomes a chronic condition, progressing slowly and silently, showing no signs until it has damaged the liver, which can take decades. Cirrhosis sets in. Patients may experience jaundice, yellowing of the skin and eyes, ascites, fluid in the abdomen, weakness, fatigue, and loss of appetite. At this stage, the damage to the liver is irreversible. This is why early diagnosis is critical. Unfortunately, identifying hepatitis C in its early stage continues to be a challenge. Our best hope is to encourage those who are at an increased risk to get screened. A simple blood test could make the difference between a short course of medical treatment, and end-stage liver disease, or even death. Okay, so now they're saying a generation ago, patients diagnosed with hepatitis C had a 50-50 chance of survival. Today, thanks to recent advances and antiviral medication, the cure rate is now between 90 and 95%. But you know what? There's a lot of junkies that will not reach out for help. I bet 10 to 1, many of them will still go out here and get high and share needles until it is completely over, where they just die out. In addition to being more effective, current medications have fewer side effects and can be taken orally for a shorter period, between 12 and 24 months. depending on the severity of the disease and the specific type of hepatitis C. Once the body is free of infection, doctors can focus on managing any effects of liver damage required as a result of the disease. But here, wouldn't it be counterproductive if these people have the disease but they refuse to get off the drug? I just don't see how they're going to cure all these people. How addiction can override anything else, especially their desire for the drug. All right, that's my air conditioning trying to pop back on. If you are at risk with hepatitis C, talk to your doctor about a screening. You should test positive for the virus of hepatology, and transplant center is like the UVA health system is your best option for comprehensive care. UVA is a dedicated hepatitis C clinic with a skilled team. Okay, so they're just telling these people to go for treatment, that's all. But this completely damages the liver. And if it's on the rise, look, they can't even get cancer under control in the rural areas. So now you're getting slammed with the cancer that they're dying at a high rate. And now you got the hepatitis C, which is completely hitting the opioid addicts extremely hard in the country. So, hey, with addiction, it's going to bring a lot of other health problems. And I also noticed over the years, even people that get off of the drug, get off of heroin, they seem to face an early death anyway. I think the damage is done in their bodies. And it just seems like once they get in their 50s and even their late 40s, a lot of these people just drop dead. And some of them have been off of heroin. I read about a person that was off of heroin for nearly 10 years, and they still ended up dying in their early 50s. So this does damage beyond any type of repair, just in general. Please leave your comment and subscribe. And if you can donate to my channel, please do. Peace, family.